white ceiling, my mom's warm bony palm covering my hands, clothes wet from sweat and tears, and lay down on something unpleasantly cold and stiff. This is a dream that I dreamt over and over. It was too vivid to be a dream, but too blurry to be a memory. And I was 15 when I found out that this dream actually happened in real life. I was casually talking with my parents at a dinner table about this repeated dream, and they asked me, "You still remember that?" So, according to my mom, this is what happened. We were living in Czechia when I was 2 years old, and one day my temperature soared up to 40 degrees Celsius. My parents rushed to the emergency room, but I passed out on the way. Once we reached the hospital, the doctors conducted a blood test immediately. And it turns out that I had an excessive amount of white blood cells. And by excessive, the machine that measures the number of white blood cells ran into an error because the number was uncountable. The Czech doctors also speculated the number is abnormal. And then he announced to my parents with his halting English, "Cancer. Child blood cancer. Maybe." I was pretty unlucky to be potentially diagnosed as a cancer at that time in Czechia because swine flu ravaged around the countries, resulting in hundreds of patients. Due to the lack of beds, they laid me down on a temporary bed made out of bricks. Do you guys remember that I was lying down on something stiff and cold? That was a brick bed. It wasn't just a dream. It was a memory of my body's fight for survival. And after hearing this story from my parents, I started to notice other things. My mom would always get overly anxious whenever I'm sick. My dad would always tell me to go and visit a doctor, although it's just a cold. And back then, I was just embarrassed that they're overreacting. But later, I realized for them, it's as if they're still at the Czech hospital, still living that night. And I was 17 when I found myself on the other side. I wasn't the patient, but I was a caregiver. One day, my mom had volvulus, which occurs when intestine becomes twisted, resulting in abdominal distension, pain, and vomiting. It wasn't anything serious. Everyone could have experienced at one point. But my dad was away for work, my sister was away for college, and suddenly the responsibility fell on me. I wasn't her child anymore. I was her caregiver, and she relied on me completely. In those moments, I felt what my parents would have felt when they almost lost me. The helplessness, the fear, and the desperate waiting for solutions. And taking care of my mother made me realize how hard this task is. I realized the true resilience that countless caregivers who are in better or worse circumstances than me have, and the challenges they face day after day. And this motivated me greatly. As a caregiver, I had to directly communicate with the doctor. And what struck me was less his knowledge, but his calmness, his precision, and his ability to clarify all the process without overwhelming me. And that steadiness not only released my mom's pain, but also saved me from drowning in fear. And what I learned from these two incidents is that illness is never just physical. It's emotional. And in fact, according to WHO's study of more than 247,000 patients from 60 countries, people with physical illness are 3 times more likely to suffer from depression. Then I started asking bigger questions about what it means to be a medical professional. Not just how do they treat disease, but how do they deal with the people who are affected by disease? And what does illness do to a family? And how can doctors further help? We, including myself in the past, like to think disease in simple terms. You either beat it or you don't. But the truth is, sometimes the body heals before the story does. And often, deepest scars are the invisible ones that we carry the longest. And this realization shifted everything for me. Illness is not just a medical condition. It's a human one. Because behind every diagnosis, there's a person who's scared, a patient who's exhausted, and the memory that still lingers. So to heal a person, not just the symptoms, we need to consider all of these. We need a doctor who understands that patients' fear can be as real as their fever. Even a memory buried so deep that one can barely recall can shape how they feel today. And being a doctor is not just to diagnose, prescribe, and walk away, it's to stay with the patients in their most vulnerable moments. And that's true for every type of illness. For example, when someone sits down in a dental chair, they're not just bringing their teeth. They're bringing their trust, their anxiety, maybe a bad memory from when they were 7, or maybe a fear that they never put into words. Because I know how it feels like to be a silent patient, to lie on the battlefield of fear, not knowing what tomorrow is going to bring. Because I also know how it feels like to be a caregiver, to stay outside of the battlefield, desperate to help but powerless to fight. I not only have knowledge, but the sensitivity to understand. And now, with these abilities, I want to stand on the other side. I want to be the healer, to help the exhausted soldiers who are still fighting in the battlefield. And that's the kind of doctor, a kind of dentist I aspire to be. Because medicine isn't just about curing a body. It's about healing a person, closing a story, and guiding the patients off to a fresh start. Thank you.